Why did you choose to use that rather than the F18 Pylarify?
I think that's the only one that's available at my institution that I ordered from. That's my understanding. I could be wrong.
You're probably right.
I will admit I'm a little fuzzy about it, but I think that's what they use.
Okay. And do you know if you had your choice to use either F18 or gallium, which you would pick?
Oh, I don't have all the nuances of that. I don't really have a strong preference. I think I would defer that to the radiologists who perform this procedure and what they prefer.
Okay. Now, does your practice own any scanners?
No.
So no CT or PET or MR?
No.
But ultrasound?
We do have ultrasound, yes.
Okay. I had someone say that they, rather than fusing an MR image to the ultrasound for biopsy, they were fusing a PSMA image to the ultrasound. Is that something you would ever consider?
Sure, if insurance companies allow us, we'll pay for it. But I'm amazed that whoever told you that, because insurance companies do not cover that at all.
Yeah, I'm pretty sure his patients paid for it. I think you're exactly right. I do not think it was covered by insurance, but for some reason he was able to do it quite frequently. And are you aware of any other prostate cancer treatment or diagnostic options on the horizon?
Oh gosh, that's a very broad-based question.
It is.
I think there are a lot of treatments and options on the horizon. They come out every month. So,
do you think PSMA imaging would make a difference or do you think those treatments would somehow cause PSMA imaging to be used more frequently? Any of them?
I don't believe so, but I do believe it's compelling to somehow use the PSMA molecule to actually provide therapeutic benefit to prostate cancer cells. I think that would be a very interesting, vehicle for treating prostate cancer.
Yeah, I know there are some studies out there where I think it's lutetium is linked to the PSMA.
Right.
I don't know if there's any or if you can even link any kind of chemo agent to it.
Yeah, that would be intriguing.
And do you have any other thoughts about how the use of PSMA might affect your treatment of prostate cancer patients over the next few years?
Yeah, I think definitely the newer agents, the immunotherapy agents like PARP inhibitors, all those products, I think they're slowly evolving and they're going to be a huge player in prostate cancer.
And how would PSMA affect the prescribing of those therapies?
It's a good way to help monitor, the progress of your treatment, to see what is happening in terms of, metastatic disease, measuring the volume of metastasis. I think those are interesting options.
And are any of those currently reimbursed or available for you to use?
Not that I'm aware of.
Okay. Is there anything I missed? Anything you feel like a manufacturer should be aware of if they're thinking of?
I think just other than what I alluded to earlier, which is I think the manufacturer is really missing out on a huge potential for use of their product in patients who have already been diagnosed with prostate cancer, right?
Mm-hmm.
Before treatment, so before they embark on surgery or radiation therapy,
Mm-hmm.
I think the manufacturer should really focus on those patients who have high risk features like PSA greater than 20, a Gleason score 7, 8, or 9, or 10, or positive digital rectal examination. And I think they should really focus on trying to get PSMA approved for those patients instead of ordering the bone scan, the CAT scan, which I think is archaic and very rudimentary exam. They should advocate for PSMA testing prior to embarking on surgery or radiation therapy. And I think that is the huge potential that they're losing out on. That's a huge number of patients. And if insurance companies can cover that, that would be amazing, for them.
Mm-hmm.
So that's what I would say.
Okay. And how did you first find out about PSMA imaging?
I went to an ASCO meeting.
Okay. Have you seen it promoted in any urology meetings?
Yes. American Urologic Association meetings. I attended a seminar. I attended a dinner meeting locally. So there's a lot of venues that we've gone to.
And you mentioned the facility where you currently order your scans. Do you know of other facilities in your area that are offering it, or is that really not a concern?
No, the only facility is the tertiary care center locally. I'm not aware of any other places.
Okay. Well, I thank you so much for your time. I appreciate your speaking with us.
Oh, my pleasure.
And someone will follow up with you from Delta, who originally set up the interview. So, but thank you. Thank you so much for your insights.
Okay, yeah, thank you.
Okay, bye-bye.
Bye-bye.